Continue.
Yes, I got to press continue. Okay, great. Well, welcome everybody. And today we're going to be talking about a very interesting topic. It's a difficult topic, and it affects both caregivers and residents and healthcare providers alike. And as you can see, I'm in scrubs. I just finished a pretty busy day of patient care, and it's really fascinating because a lot of the topics we're going to talk about today I had to address in real time, so it's quite perfect timing. So the lecture topic is understanding the aging process for families and caregivers. And it's also applicable to those who are aging, because quite frankly, we're all aging. For those who've attended the start of the lecture series, we did what is normal aging. And what I did was I went through all the large organ systems and described what's normal versus what's pathological, so that you know when to seek medical care for yourself or for your loved ones. So understanding the aging process for family and caregivers is for everyone. And during that normal biology of aging lecture, I explained that those who are young, beyond their 20s, they start seeing the effects of the aging process. And certainly by 40s and 50s, and then of course when you're in the 80s and 90s, it becomes very obvious, the aging process. But we're all aging, and the key to this lecture is I'm not trying to pigeonhole this to those who are 65 and older. I think anyone at any age would benefit. So the questions we put out on the flyer, and I hope you guys received that informational invitation, was: do you feel overwhelmed caring for a loved one? Do you think that your loved one is just being difficult and needy? And is your caregiver role causing a strain on your personal and work life? So those are the big topics that we're going to discuss today. And I'm definitely going to answer those questions. And feel free to interrupt me and ask questions along the way, or if you want to wait to the end and ask them all at that point, you can totally do it. If you don't want your questions recorded, once they stop the recording, I'll stay on and you can certainly ask me all the questions you want. So let's go through the way I approach this with my patients, my families, and the medical staff that I work with. So when I think of the aging process, the aging process, as I said, is the lectures for families and caregivers, because the aging process affects both parents and caregivers. And it's multifactorial. So it's multifactorial in that there's physical health, in which which I gave a couple lectures on. It's mental health, in which the lectures I gave was more of depression, anxiety, sleep disturbances as a result of your mind racing, and financial health. Okay? And so in order to really gain control over the aging process, you have to recognize that it's multifactorial in nature. And yes, addressing one component of that is helpful, but to be truly comprehensive and successful, you have to address both physical health, mental health, and financial health. So let's start off with physical health. When you're caring for yourself or for others, it's very, very important to understand the aging process. We did record what is normal aging, so I encourage you to review those videos, and if you need me or want me to repeat it, I absolutely have no problems giving that lecture again, because it's so critical, and it's something that should be repeated over and over again because there's too many organ systems to really grasp in 1 hour of video conferencing. But it's important to understand what is normal versus what's pathological. And the reason why I say that is because if you're experiencing a normal biology of aging cognitive loss, and this is one of the patients I dealt with today. So if you're feeling that your memory loss is, you're thinking, oh my goodness, it could be Alzheimer's disease, it could be one of these types of dementias, or you don't even know the types of dementias that are out there, but you're terrified. We've had patients who are so fearful that what they're experiencing is Alzheimer's disease, that they have deliberately and intentionally socially withdrawn so that their friends and peers would not see the deficits that they're experiencing. They've stopped their physical activity because they were afraid that they would not be as successful as they were in the past. For example, I had a gentleman who used to play golf who stopped playing his really passionate game of golf because he was afraid that he wouldn't remember which club to use for which hole. Same thing, I had another patient who loved to play chess and stopped playing because he was afraid that he wouldn't be able to think the 3 steps ahead and people would start seeing him lose his game. So he just stopped. And I can go on and talking about a whole host of patients that felt that their cognitive deficits were pathological in nature. And what they ended up doing is self-diagnosing, withdrawing from all these activities, and socially isolating. Social isolation, and that's why I absolutely love assisted livings, because it's very difficult to be socially isolated in an assisted living. They encourage you as much as they can to have dining with others and activities, and they're constantly checking up on you. So it's really a challenge to be socially isolated, except during pandemic lockdown time. Now that's an isolated event that happens once, every 100 years or so. So, but for normal situations, it's hard. And the reason why that's so important is because when you socially isolate yourself, like the 2 patients who I just talked about, then you're trapped with your own thoughts. And for all my patients who have done this, they've unanimously slipped into a depression. They slipped into a depression, and then their loved one sees that there's weight change, mood change, and brings them in for me to evaluate. And at that point, it's extremely difficult for me to differentiate whether they have a dementia of the Alzheimer's type or if they have depression, because they have a lot of overlapping symptoms. So at that point, I'll have to treat with an antidepressant. And once the depression, if it does exist, is lifted, then I could do a comprehensive memory test to evaluate their cognitive status. So the reason why I give all these examples is understanding what's normal aging can prevent this, because for a large portion of my patients who self-diagnose, they misdiagnose. So a lot of them misinterpret that because they went to the supermarket and forgot to purchase what they had originally planned to go to supermarket for. So if they went to the supermarket for ice cream and they came home with toilet paper and they came home with other items, dry items and so on, but they didn't get the ice cream, they're going to say, well, my memory is shot. If they forget somebody's name, if they walk into a room and forget why they're there. So those types of instances are having my patients concerned that they have Alzheimer's disease. And once again, a large portion of them have misdiagnosed. And when educated, we unanimously, me and the patient, come to the conclusion that it's normal biology of aging. It's not Alzheimer's disease. So when you're dealing with your physical health to age successfully, and understanding the aging process, it's important to say, is this pathological or is this normal? Same thing with physical health. Manifestations of diseases when you're 80 years old is very different than when you're 20. So for example, a person who has thyroid disorders, when they're 20, the hyperthyroid patient is, everything is increased. So they have increased swelling, heat intolerance. They have a lot of bowel movements. They're thin. Their metabolism is up. That person who's hypothyroid, when they're in their 20s, everything is slow. So they have weight gain. They are very sluggish. Even mentally, they are not as sharp as they used to be. But once you get into the 80s and 90s, that clinical presentation that was typical, textbook typical when you were 20 is dramatically different when you're in the 80s and 90s. So an individual who has hyperthyroidism might not manifest with those clinical symptoms, and hypothyroidism might not manifest. So it's very important to understand that disease presentation as you get older is not as clear as when you were younger. So you have to take all the cues that you can see and kind of piecemeal it together. That's what geriatric medicine is. It's really listening comprehensively to understand what's the root cause of the problem. So we talked about individuals misdiagnosing themselves with Alzheimer's disease, creating a depression. Another very common factor is when an individual has hearing loss and they don't want anyone to know that they have hearing loss, but they keep misinterpreting what's being said around them. And then they socially isolate as a result of the constant conflict and slip into a depression. And the reality is, once again, it's the root cause is the hearing loss that's easily fixable by either removing the wax or giving a hearing aid. So understanding your physical health will absolutely give you a better quality of life, in addition to examples such as sleep. So if you're having difficulty sleeping, I always say, are you having difficulty falling asleep? Or are you waking up too long? And do not take a sedative hypnotic to fall asleep if your sleep disturbance is as a result of anxiety, or is as a result of worry, or is as a result of pain. So if you have an anxiety, we give an anti-anxiety medicine. You have pain, we address the type of pain. Is it neurologic pain? Is it muscle pain? Is it, what kind of pain are we dealing with, so that we can properly pick the medication to treat it. So physical, very important to take your all your medical concerns and have a diary. Have a diary of what the symptoms are, what makes it better, what makes it worse, so that when you go to the doctor, you can be very clear and say, this pain is sharp in nature. It's worse when I take a deep breath. It's better when I'm laying down. It's very important to know the type of pain and the location of pain. So for example, today I was dealing with someone who was concerned about some myocarditis, and the question is it positional? Does the pain move? Does the pain get worse when you're moving? If so, that's consistent with it. Is it reproducible? If it's reproducible, that's not consistent with it. So what you want to do is just really take a good history of yourself and say, what's making this better, worse? what's bringing it on. Is it stress? Is it heat? Is it cold? What's going on? And that will help your physician make the proper diagnosis. So multifactorial. So physical health is important to absolutely address. Then there's mental health and financial health. So mental health is so under-recognized. The depression, anxiety, fear, underlying psychiatric disorders such as bipolar, and a whole host of personality disorders that were present this individual's whole life. These disorders don't go away. They may change in symptoms, where you see more negative symptoms versus positive symptoms, but the actual organic problem, it remains unless it's being treated. So mental health is something that has to be addressed at every doctor's visit. And if you yourself know that you have a history of depression, or you have a history of anxiety, or panic disorders, or fears, phobias, that's something that you definitely need to address with your physician so that you're on the proper medication for it. Because a lot of my patients who have depression don't come to me and say, I'm depressed. They come to me and say, I have back pain, I have headaches, palpitations, I have neck pain. And so rather than saying you have neck pain and that's because you're depressed, we're saying, okay, you have neck pain, let's take a look at it. Could it be bone? Could it be muscle? Could it be nerve? And that's how a lot of physicians think. If you say you have back pain, they look for mechanical problems with your back, if you have, vertebrae issues or whatnot. And lots of times we spend not only physical time doing physical exams, but imaging and laboratory results, and everything comes out negative. All imaging is normal, laboratory results are normal, physical is normal, but yet this person still has pain, and it really is affecting their quality of life. And then we find out that the pain is as a result of all the manifestations that are going on in that person's mind. So whether they're depressed or they're anxious, or other features that are manifesting as physical symptoms, when the root cause of the problem is mental, and that's where we have to address it. And then financial health. So financial health can't, I have not done one for you guys, but I probably should do a whole entire lecture on financial well-being and financial health. And the reason being is a lot of older adults have saved, and they're very worried how much money they will have, and will they outlive their money, or will the money outlive them? And so it's very important to have everything documented for your mental comfort, and then of course for your family. And what I recommend, and I have with me at all times for my patients, is you can buy it anywhere. You can buy it on the internet, or you can look around. And it's like a black book. They have blue books, they have all kinds of books, and you don't have to get this particular one. You can get any one that you find. And basically it's an estate record. And in it, if you kind of, when I go through it, it has life insurance, it has securities, it has savings bonds, real estate, professional and advisors, who's the lawyer, who's the accountant, your social security cards, where is it held, your will, where is it held, your wishes, what are your wishes, where's your code status, who is your healthcare proxy, who's your power of attorney, and do you have a prepaid funeral? All that financial, medical, legal type of stuff should be consolidated in one book for yourself as well as for your family. Because what I've noticed is that it creates a lot of anxiety if a resident, a patient, a senior is unsure of where everything is, or if they have a false sense of confidence that they took care of everything and now the children just have to execute their wishes, when the reality is that will is now 20 years old and the people they named as healthcare proxy has either passed, or they don't like that person anymore, or that person has their own medical conditions and can't be responsible for caring for you. So it's very, very important to review on a annual basis, and sometimes even more frequently, what legal documents you have, if they're up to date, if you want to change them, and what your wishes are. So those are the three components: the physical, mental, and financial. So going back to the questions that we had on the flyer, do you feel overwhelmed caring for your loved one? So if the answer is yes, then my next question is why? Why do you feel overwhelmed? Do you feel overwhelmed because their physical demands are beyond what you can handle? So they're incontinent and you just don't have the strength to lift them or the resources to constantly change them. Is it that they have memory deficits and they're asking the same question over and over and over again, but you promised never to put that loved one in a Alzheimer's unit or a nursing home or an assisted living, or if you're in assisted living, going to a secured unit rather than the independent section. So why are you feeling overwhelmed? So is it the physical part? Is it the biological aging? Is it the medical? Is it the finances? Is it that you've come to the conclusion that you need 24-hour care, but it's extremely expensive and you don't know how you're going to handle it? Or is it that you decided, okay, I'm not living at home alone, I'm moving into an assisted living. How can I allow my loved one to live in an assisted living when I just don't know how long they can be there financially? So are you feeling overwhelmed caring for your loved one because of their medical conditions, of their physical conditions, of their financial conditions? So the answer to that question is you have to self-reflect and say, why do I feel overwhelmed? And I'm a huge fan, and I tell my patients all the time, and I tell my students all the time to always have a pen and paper available and jot down your reasons. Jot down the reasons why you feel overwhelmed. And then you can attack each and every one. So there are social workers available, and they really help with coordinating resources for you. So if, for example, you're overwhelmed financially, well, they're going to ask you questions and say, were you or your husband a veteran? If so, did you know that there's veteran benefits? And they will share with you what aid and attendance is. They will share with you that the VA is not just a VA in one location. Sometimes they have, depending on the state, they do have satellite clinics, which might be closer to you. So the social worker is very instrumental in telling you what resources are available. But you yourself can say, I am overwhelmed. I'm just going to pick Alzheimer's disease, for example. I feel overwhelmed caring for a loved one because they have Alzheimer's disease. Let's just say they do. Okay. Um, the the easiest thing for me to recommend is to understand what resources are available for you. And your physician might be able to help you, or you can call your local chapter of the Alzheimer's Association or Agency on Aging, or senior centers. Senior centers are, I think, under utilized and undervalued, and it's a shame because the senior centers are there for the seniors to take advantage of. And a lot of my patients who have attended senior center activities love it. And what they do is they'll schedule their day and they'll say, Monday, I'm going to this senior center, Tuesday, that senior center, Wednesday, that senior center. Whether it's because there's a lecture or whether there's a guest entertainer or whatever it is, but their day is pretty booked up. And the beauty of living in an assisted living in the independent section is that you can come and go however you want. You could participate in the activities that are offered in the assisted living, or you can go to the senior centers and see what they have to offer in addition to what your facility offers. So knowing the directors of the senior center is very valuable because you can say, hey, I am caring for my husband or my wife, and they have, or my father or mother, they have Alzheimer's disease. What resources do you have? And that senior center could say, okay, well, we have this psychiatrist, this social worker, this psychologist, this support group. Support groups are very, very helpful because if you're feeling overwhelmed, lots of times you think that you're alone feeling overwhelmed, but the reality is there's plenty of other people who feel just as overwhelmed, and why reinvent the wheel? If those people who are feeling overwhelmed with similar disease, caregiver burnout and stress and situations, of course, no one's identical, but similar, then you can learn from their experience on, a loved one who's wandering or who's repeating themselves, or you feel like you're getting frustrated or losing your temper. And the last thing you want to do is lose your temper with somebody who has Alzheimer's disease, because if they can't comprehend what you're saying, they just see that you're angry, and now you created a negative emotion in them, and they're going to be even more difficult than they were. So you don't want to do that. So just understanding the different disease processes, whether it's Parkinson's, Alzheimer's, Lewy body dementia, Parkinson's disease dementia, vascular dementia, there's support groups for pretty much every disease out there. And with the beauty, one good thing of this pandemic is that it has forced us to communicate via Zoom like we're doing right now. And so, you and I are in different time zones, and yet we're able to see each other and talk real time. And so that's very helpful, because if you are experiencing caregiver burnout, you can certainly stay in your apartment or in your home and have a telehealth visit with a psychiatrist, a psychologist, a social worker, and have all the resources at your fingertips. So that's important. The next question was, do you think that your loved one is just being difficult and needy? Now that I hear all the time. The question is, do you really believe that? And if that's the case, we have to figure out why. Or is it that you're not sure, it's just you're thinking that they're just behaving, your loved one is behaving this way because they want attention. But let's take a look at why your loved one is being difficult and needy. With certain disease states, there's personality changes. So, for example, with frontal temporal dementia, which happens in the younger adult, there is definitely disinhibition associated with that. With Alzheimer's disease, there could be individuals who have personality changes. So individuals who are very nice, who are now nasty, and individuals who are very nasty, who are now nice. So those personality changes can certainly make you feel like your loved one is being difficult and needy, but the reality is it's a underlying medical disorder or disease or condition or syndrome that needs to be addressed. So Alzheimer's disease is very common. Lewy body dementia fluctuates. Delirium fluctuates. Depression sometimes is not always straightforward. As I mentioned earlier, you can have physical manifestations of a mental condition that will go undiagnosed for a very long time. But depression could be, a person could have a major depressive disorder coexisting with a generalized anxiety disorder. And so the person can be very anxious and nasty, but they're really hurting inside and screaming, somebody help me, I'm extremely depressed. Now it's very hard for us to be empathetic to this nasty person because we don't see that depression, we just see the nastiness. And so that individual being difficult and needy might be screaming out saying, I have major depression with generalized anxiety disorder, and that person needs to be checked out. So the other thing is a lot of older adults are fearful. They're fearful of being alone. They're fearful of dying. They're fearful of running out of money. They're fearful of getting diagnosed of a disease that they don't want to deal with. So there's so much fear and uncertainty that it can be manifested as being a difficult person. Lastly, insomnia. If you're the caregiver of someone who's you're perceiving as difficult, why is the person being difficult? How are they sleeping at night is one of the first questions I ask. And if they're not sleeping well and they have a sleep disturbance, or let's just say they have, they think they're sleeping well, but they have sleep apnea. If they have sleep apnea, every time they wake up from that intense snoring, the reason why they're waking up is because they're apneic, they're not breathing, their brain senses no oxygen and forces them to wake up so they can take a deep breath and oxygenate the brain. Problem is, when a person has insomnia, whether it's due to sleep apnea or any other issue, if they don't have deep restorative sleep in the first couple hours after they put their head on the pillow, the following day, they will have a cloudy mind. They will be very short-tempered, and they won't be the person that you used to know. You know, for children who behave this way, we say, okay, it's time for your nap, and we put them to sleep. Older adults, we don't say that. Obviously, that's not something that even comes into our mind, but it should come into our mind. Not that I encourage you to sleep during the day, I don't, because that would reverse your sleep-wake cycle. But if you're having these irrational behaviors similar to a child who has sleep deprivation, perhaps you as an adult have sleep deprivation and should undergo a sleep study to see if you have restless leg, if you have sleep apnea, or if you're having a host of other issues not allowing you to have a good night's sleep. Something even as simple as nocturia, where you're producing urine at night causing you to go frequently to the bathroom, interrupting that high quality sleep. So, do you think that your loved one is just being difficult and needy? Uh, that's something that you should definitely explore, because there's probably a good chance that there's an underlying undiagnosed medical condition causing these manifestations that you're experiencing and, of course, getting frustrated with. The last question is your caregiver role causing a strain on your personal and work life? And this is a very important question, and we see this unfortunately happen quite a bit. It seems like females are more of caregivers than males, and so the daughters are really torn. They're the sandwich child, where they're trying to take care of mom and dad, they're trying to take care of their children, and of course they have a significant other who's expecting them to be a partner, a husband or a wife. And so if they're working a full-time job and having all these other demands, something has to give. And it's not uncommon that I see daughters of individuals who have parents who have illnesses or needs. That daughter ultimately ending up in a divorce from their husband, because the husband feels that his wife is either caring more for their mom or dad, or spending too much time on their mom and dad, and that no one else is helping out. It all falls on their wife, and they just, that's not what they signed up for. So it is not uncommon that I've seen marriages fall apart as a result of the consumption that the caregiver has with their loved ones. So the important thing is, when we talk about work-life balance for those who are in the workforce, we don't just talk about it for work and life, meaning your husband and your children. We talk about it meaning your parents or whoever you're caregiving for, because that can be extraordinarily consuming, time-wise, financially wise, emotionally wise. And 25% of those who are caregivers do unfortunately end up being diagnosed with a depression, because all these stressors are just wearing them down and there's limited coping skills. So what is my solution? My solution is being very transparent with yourself and saying, okay, I am the caregiver for my husband, my wife, my husband, my wife, my dad, my mom. But I can't allocate as much time as is needed. And so you don't want to abandon your loved one. You don't want to have any feelings that you're not doing the best you can. But as I say to my caregivers all the time, if you don't take care of yourself, you certainly can't take care of your loved one. And I always say, it's the same analogy as when you're on the airplane and they say, if the air pressure changes and the oxygen mask drops, put it on your face first, then put it on your children. Most parents would say, no, I'm going to put it on my children first and then me, because my child is more important than me. But the reason why they say put it on you first and then your child is because if you put it on your child and then something happens to you, what's going to happen to your child? So the same thing with caregivers. It's very important for a caregiver to take care of themselves just as much as it is to take care of their loved one, because we've seen caregivers pass away with heart attacks and strokes, and their loved ones live while they passed away. And it's because they didn't come to peace with the fact that they are at their limit and that they can't do it anymore. And so at that point, they have to say, okay, I can't do this. And then first thing you say is, what are my financial resources? If you do have financial resources, then there's geriatric care managers. I don't know if there's one in Ohio, but certainly in Connecticut and in New York and the East Coast where I'm at, geriatric care managers are very common. And it's basically an individual who is either a social worker or has some form of geriatric medical knowledge. And that person is exactly what the title says. They're a care manager of the older adult. So that person is the one who will pretty much do everything for you. They're the ones who are going to talk to the assisted living. How is Mr. Smith doing? Mr. Smith is due for his dental appointment. Do we have an appointment? Do we have a van ready to take care of him? They even go to the appointments at times, depending on your care manager. The care managers I work with go to the hospital, go to the doctor's appointments, go to the care conferences at the assisted living. They do absolutely everything. And they report to the wife, the son, the daughter, and say, okay, these are the results, these are my findings, and this is where we're at. And this way, the loved one, when they're visiting mom or dad, rather than being the caregiver, they're being the daughter who's loving and who's enjoying that encounter where they're not frustrated or snapping at mom and dad. It becomes a higher quality of interaction and life for everyone. But you have to have the financial resources to hire that individual. If you don't have the financial resources, then talking to your social worker and say, what is available in my state for me? Can I have a visiting nurse come relieve me? Can I have grab bars in my bathroom? Can I have a home evaluation? Can I have physical therapy? What is covered under my insurance? What is covered under my long-term care insurance? And so on. So if you feel as a caregiver that there's a strain on your personal and work life, something has to give, because if it doesn't, then unfortunately, it will take a toll on you, and you don't want to have your children affected, your significant other affected, because ultimately that affects you. And when I see caregiver burnout, it's very obvious. The daughter and the son, or the husband and the wife, they're so stressed out that whatever their loved one says, they just jump. And that's not a good quality of life for anyone along those lines. So I want to leave 10 minutes or so for questions, but I want to summarize. So our title was Understanding the Aging Process for Families and Caregivers. So this lecture is meant for both the family members as well as the caregivers. And the most important thing is acknowledging that you're feeling overwhelmed. The second most important thing is getting organized and evaluating what resources you have and how to tap into them. And then the third most important thing is to actually do it. Because even though you have all these resources, you have to use them so that you can make the most of the aging process. So I will go ahead and open it up to questions.
Am I the only one going to ask questions, or others?
No, go ahead. Go ahead.
Well, you mentioned back a little ways about some cause of people having to get up and go to the bathroom more times at night. They created more urine.
Yeah, nocturia.
I hadn't heard that word before.
Yeah, it's not, unfortunately, it's not a common diagnosis, but if you Google my name and Nocturia, you'll see I have a couple conferences and videos and so on it. Because I was principal investigator of a clinical trial for it. So that's why I'm very familiar with it. But the importance of it is that your urologist will identify it and help you to say, is this nocturia or is this overactive bladder? And first thing they're going to do, they have to figure out which one it is. And I would not recommend a PCP, although some PCPs can do it. I would definitely recommend a urologist and say, hey, I'm up so many times a night voiding, it's interrupting my quality of sleep, and we evaluate it. And they're going to say, how many times are you voiding during the day? And they're going to say, do you have urgency and incontinence or just frequency? So those are all those questions that you want to kind of predict before you go, so that this way you can have a diary and you could say, I urinate, I'm just make believing, 10 times during the day, 4 times at night. I have never been incontinent, or I have been incontinent. I'm sitting down listening to Dr. Varano's lecture, and all of a sudden I feel I have to go. And if I don't go, I lose urine. So you want to write all those symptoms down. And then you also want to write down, what time do you last consume a beverage, and what is that beverage? Is it tea, coffee, water, juice, alcohol? What's the last time? And then what's the frequency of your urination? So are you getting up in the middle of the night truly to void and go back to bed? Or are you getting up in the middle of the night because you can't sleep, and while you're there, you might as well go to the bathroom? Or, what is your reason for getting up in the middle of the night? Those are the questions they're going to ask you.
Okay. Well, it's definitely to void, because I'm sleeping soundly, and then all of a sudden I have this urge to go to the bathroom, and then I have trouble getting back to sleep frequently. So it makes it rough. When you said, and the other questions past that one, when you said, if you don't get enough sleep at night, you shouldn't take a nap during the day. And
Yeah.
sometimes that helps me take a nap.
Right. So you have to be careful. So I'm not a fan, and I know a lot of people are, of afternoon naps. In Europe, there's the siesta where they
Right.
shut everything down. But the reason why they do that is because it's too hot, and it's not safe to be, having shops open at 2 o'clock when the sun is the highest and whatnot. So they allow everyone to close the shades down, take a nap, rest, and then they reopen it when it cools down, and then they work later. I'm not a fan of afternoon naps, because what happens is your afternoon nap can go from 1 hour to 2 hours, and then it just disrupts the day. So not only disrupts the day, but it could possibly create this reverse sleep-wake cycle, where because you've slept so much during the day, you're not tired enough to have a full 8 hours night sleep. And that's really what you want. So I always encourage people to have a pure night's sleep and eliminate those daytime naps, so that you don't get into that cycle of sleeping so much during the day that you're up at night. It becomes very disruptive to your circadian rhythm, to your mind, and to your overall well-being. Now, I get the fact that you're probably napping because you're up you're up at night so frequently voiding. So I would definitely advise you to get that checked.
The other thing you mentioned was not taking any pills to help you sleep. And I have a lot of back pain, so I take Tylenol at night. Is that not a good thing?
So when I said don't take medicines to cause you to go to sleep, it's without knowing what the root cause of the problem is. So I don't want you to have back pain and take a sedative hypnotic for back pain. If you have back pain, absolutely take Tylenol, take painkillers, and that will alleviate it. If you have anxiety, I don't want you taking a sedative hypnotic because you're anxious. Do you see what I'm saying? So when I said,
Yes.
I don't want you taking a sleeping pill to go to sleep, that's unless you understand why you can't sleep. So you're doing a perfect job. If you're in pain, you take Tylenol, it relieves the pain, you fall asleep. That's exactly what I want you to do. I just don't want you taking an Ambien because you have back pain.
Okay. And you mentioned the 8 hours of sleep. Um, I automatically wake up every morning at 5 and I don't get 8 hours of sleep. So, and I don't normally go to sleep, before 10:30 or so. But
So,
can't
you know,
see
yeah,
anything
so
about it.
yeah, so you make a great point. So 8 hours is an ideal number, but it doesn't have to be. So if it's truly, honestly, the first 3 hours of sleep. If you put your head on the pillow and you fall asleep and you're sleeping straight for 3 hours, 4 hours, uninterrupted, that is your high quality sleep. That's really what I'm going for. I don't want people staying in bed for 8 hours just to do it. We shoot for 8, but everybody is different. So I'm like you. I don't have 8 hours of sleep. Would I like it? Absolutely. But it's just not. I just can't. I have to be up just like you, 5 o'clock, because I have to leave by 6 o'clock because I have a 7 o'clock patient and it's an hour drive. So, we all kind of have our things. But so I just said 8 ideally. If you're getting less than it, but you're feeling rested, then you're fine. If you're not sleeping the first couple hours, that's my biggest concern. So if you said, hey, Dr. Brown, I sleep 6 hours, but I don't wake up and I'm, fully rested the following day, I have no problems with that. But I don't want, some patients are saying I have 2 hours of sleep or 3 hours of sleep. And I say, well, the golden number is 8, but, I'm more than happy to do less as long as it's uninterrupted high quality.
Okay. Do you have any questions? Well, you've answered my 3 questions. I was hoping there'd be other people. I didn't really understand that this was going to be mainly about caregivers. And my partner here, my friend and I are not caregivers, but it was information that we could use. Our parents are gone.
Yeah. So caregivers don't necessarily have to be you taking care of your parents, but you taking care of each other or you taking care of your friends, at the assisted living. And I don't mean caring like, changing their incontinence products, but caring for them. If you have a friend and they're asking the same question over and over and over again, you're their voice. And it's important for you to share pretty much everything you learned today with the nurses or their family, because their family's not here, so that they can get the proper assessments and treatment plan.
Okay.
But is there something like, did you come into the lecture with a particular question? Because if you did, I do want to answer it.
Well, when I saw the title, I forget now what the title was. There I go.
It's the title is Understanding the Aging Process for Families and Caregivers.
Right. Well, I missed that part. We didn't get the thing that said the questions that would be asked. Oh, one other thing, since I've got you here, you mentioned something about forgetting things. Do you recommend that what they advertise on TV, that is it Prevagen or something like that?
Yeah, I see that. I get asked that a lot too. So I would say if you want to use it, I'm not going to stop you from using it, but I'm not going to prescribe it either. I think that there's a lot of very, very exciting clinical trials and very exciting treatment plans for cognitive impaired individuals that were, some just got approved, some were pending results coming out very shortly. So if you're on it or if you want it, once again, I'm not going to stop you or tell you not to, but I'm not going to tell you to go buy it.
Have you had any of your patients taking it that felt like it was worthwhile?
Some of them have, and some of them have said it's worthwhile. The tricky part about it is because I'm a principal investigator and I do a lot of clinical trials, I see quite a bit of placebo effect. So if you really, really, really want something, and I see this a lot in my diabetes studies, they really want to be pain-free. And they'll come in and they'll say, Doc, I feel so much better. Oh, I'm so happy. I'm so happy. I feel so much better. And they're on placebo. So it's a placebo effect. So I can't say for sure whether those who are receiving the medication who say they feel improvement is true improvement or placebo. I don't know. So that's why I'm not going to discourage anybody. And, if you want to do it, then you certainly can. I wouldn't say not to.
Well, you indicated that this forgetfulness is a normal part of aging.
Yeah, so
That
I would encourage you to take a look at the video of normal biology of aging. So if you forget something and it comes back to you, absolutely, it's normal part of aging. If you forget something and it doesn't come back to you and you become very defensive and nasty and say it's not true, that's where we need to have an evaluation. If you have word finding difficulties that never come back. So it's okay to forget that, this is called a pen when I test you right now, but in an hour or in a day or in a week, you should know this is a pen. It has to come back to you. Those are the key things.
it just seems to me like it's a slower process of remembering things. It comes to me
And that's
a little
slow
later.
processing. Okay. It's okay. Slow processing is totally normal.
Good.
And somebody maybe that we've known forever and we want to introduce them to somebody else and their name disappears
Yeah.
a few seconds or
But
minutes.
it has to. Yeah. But as long as it comes back to you, you're okay.
That's good.
That's good to know. You reassured us. Thank you.
Thank you.
Well, like I said, I encourage you to take a look at the videos, and I could certainly do the normal aging lecture absolutely another time and hit different organ systems that you'd be interested in, and get you guys empowered. But thank you for coming.
Wait, one more thing. What was the name of that book that you held up about telling your family?
It's not a book, so you can get it on the internet. It's What My Family Should Know. So it's everything that you want your family to know about you. And you don't have to get this one. You can just Google and say, an estate record, because that's what it's called really inside. And it's basically just having everything, your securities, your life insurance, your living will, your healthcare proxy, everything is written there. And since you're in assisted living, you can let the nurses know that you have it.
We're in independent living.
Yes.
Perfect. Even better. So then you'd have to let your family know.
Okay.
Thank you.
We appreciate your help. Thank you.
You're welcome. All righty. I think we're good.